Hi, I'm Julie McIntosh, Director of Education at Compassion Care Hospice. We know if you're considering hospice for yourself or a loved one, you probably have questions. In today's video, we're going to discuss the benefits of an early referral to hospice, not waiting until the last days. Hospice is designed for anyone diagnosed with a life-limiting illness with a life expectancy of 6 months or less if the disease follows its expected course. That means hospice is available for at least the last 6 months of life. But many people, including some healthcare providers, still believe hospice is only meant for the last days of life. While we can certainly ensure that someone's last days are as comfortable as possible, hospice was designed to provide many benefits for the patient and their family during the end-of-life journey. To fully utilize these benefits, an early referral to hospice is essential. The earlier a referral is made, the sooner you or your loved ones can take advantage of all the benefits hospice has to offer to ensure comfort and improve quality of life. If a patient has a terminal illness with a life expectancy that's limited and no longer pursuing aggressive or curative treatments, it's time to consider hospice. Hospice professionals are experts in pain and symptom management, which can greatly improve the quality of life for a patient living with a terminal illness. If a patient is having uncontrolled pain or other symptoms and begins receiving hospice support and has their symptoms managed, once they're more comfortable, they're more likely to sleep better. If they're sleeping better, they're more likely to start eating better. If they're sleeping better and eating better, they're more likely to enjoy quality time with family and loved ones. In addition to expert symptom management, hospice care is holistic, involving a team of healthcare professionals that offer patients and families physical, emotional, and spiritual support. Hospice is individualized care based on the patient's wishes and needs that focuses on helping patients best cope with their illness, treating the whole individual, not just their disease. With early hospice care, patients not only have better quality of life, but research actually shows they may live longer than they would with conventional care. This could mean extra weeks or months with family, friends, and loved ones. With the support of the hospice team, which includes physicians, nurses aides, social workers, and more, your burdens can be eased in many ways, allowing you to focus on what's most important to you. A referral to hospice can be made by anyone, not just a healthcare professional. A patient, their family, or loved ones can request an evaluation to see if they qualify for hospice. There are no age or disease restrictions. Anyone of any age whose diseases or combination of diseases are in the terminal stage may qualify for hospice. Patients can continue receiving hospice support indefinitely as long as they continue to meet Medicare guidelines. Each case is reviewed by the hospice physician at set periods of time to ensure continued eligibility. A patient can stop hospice at any time and for any reason, for example, to resume curative or aggressive treatments. If the patient wishes to resume hospice again later, they can certainly do so. Once a referral is made to hospice, the patient's evaluated by the hospice team to see if they're eligible. If they are, and the patient elects hospice services, the hospice team can reach out to the primary care physician to move forward. If the patient doesn't have a local primary care provider, one of the hospice's medical directors can complete this process and oversee care moving forward. Hospice isn't about giving up hope. It's about reframing hope. Although we may no longer have hope for a cure, we can have hope that the end of our lives can be as comfortable and rewarding as possible, filled with compassion, respect, and dignity. If you have more questions on how hospice can help you or a loved one, please reach out to any of the hospices here on Vegas Healthcare. We'd be happy to answer your questions.